Occupational English Test. Practice Test 3. Listening Test. This test has 3 parts. In each part, you will hear a number of different extracts. At the start of each extract, you will hear this sound. You will have time to read the questions before you hear each extract, and you will hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Joshua Ferguson. For questions 1 to 12, complete the notes with a word or a short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Ferguson. How are you feeling?
Not so good. I'm not able to sit still, and the pain is so bad. It woke me up again last night.
Oh, I'm sorry to hear that. The analgesia we've given you should take effect very soon. In the meantime, can you give me a bit more information in addition to the consultation that we had earlier? Have you had any other symptoms?
Yeah, I have. I vomited dark green liquid about 4 times.
Okay, you vomited. But have you had any unusual bowel movements? Diarrhea, rectal bleeding?
No, I haven't.
Any pain from your loin to your groin or increased urination?
Yes, the pain has spread. I also pass urine more frequently, around 5 times per night now.
Do you have any previous conditions like appendicitis or irritable bowel syndrome?
Yeah, I have irritable bowel syndrome and take mebivarin. I also take an all-in-one multivitamin. I'm not sure about the other one. What is it? Appendicitis?
Appendicitis is a painful swelling of the appendix, which is a small thin pouch about 5 to 10 centimetres, and is connected to the large intestine where stools are formed.
Oh, and what causes that?
Appendicitis typically starts with a pain in the middle of your tummy that may come and go. Within hours, the pain travels to the lower right-hand side, where the appendix usually lies, and becomes constant and severe. Pressing on this area, coughing or walking may all make the pain worse. You may lose your appetite, feel sick, and occasionally experience diarrhea. It usually requires an operation to remove the diseased appendix.
I see. No, I don't think I've had that before.
Have you had a recent colonoscopy?
I'm not sure. What is that?
A colonoscopy is a test that uses a narrow, flexible telescopic camera called a colonoscope to look at the lining of your large bowel. The doctor would have inserted the camera through your back passage.
Yes, I remember that. They said it was normal.
Good. A few more questions, if I can. Do you smoke, drink, or take any recreational drugs?
Yeah, I smoke 10 cigarettes a day. I drink whiskey socially, about a small glass every week or so. I haven't taken any recreational drugs for about 20 years. I used to in my early 20s, but didn't everybody.
Okay, thank you. Regarding your examination, your temperature was slightly raised, 37.5 degrees, but all of the vital signs were normal. There's obvious severe loin tenderness on the left side. Now, the test came back and showed a high white blood cell count and positive for microscopic amounts of blood in your urine. Taken together, your signs, symptoms, and investigation results suggest a diagnosis of renal uretic colic. But it could be several other diseases we need to rule out.
But what is causing the pain?
The pain, which we believe is renal colic, is caused by the dissension of the tube that collects urine from the kidney, because the kidney stone is lodged inside. The resulting pain normally spreads and can cause the symptoms that you described of increased urination and urgency.
Is that why you took the X-ray?
Yes, and the results should be back shortly. Approximately 90% of urinary tract calculi or stones may be seen on an X-ray. If the X-ray shows complete obstruction, I would like to admit you, especially as we already have evidence of infection in your blood, that is to say, raised temperature, raised white cells, and the analgesia we have given you doesn't seem to have worked very well.
Extract 2. Questions 13 to 24. You hear an obstetrician talking to a patient called Gabby Simcox. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Gabby.
Hi, Dr. Stevenson. How are you?
Good. Congratulations on your pregnancy.
Thank you.
Yeah. So now I'm one of the obstetricians here. You'll probably be seeing quite a bit of me during your pregnancy.
Mm-hmm. Do I see you each time, or will there be a few obstetricians?
Well, there are a few obstetricians here, but usually, yes, you would see me each time.
Okay.
Just depends on which days and who's about. Yeah, it'd probably be me.
Okay, great.
So I've had a look at your file, and I'm here to answer any questions that you might have, and generally just to help you through your pregnancy, okay?
Thank you. I do have a lot of questions.
Well, I can see that.
Yeah.
Fire away.
Great.
So now this is your first pregnancy.
Yes, it is.
Okay, so just to clarify, you've had no miscarriages, because sometimes people don't consider these as well.
No, I haven't.
Okay, so now just with your due date and things, let me just find out, when was the first day of your last menstrual period?
It was about the 24th of March.
Okay, and do you have a regular cycle or an irregular cycle?
Yeah, no, it's regular.
Okay, it's regular. How many days?
About 27?
Okay, that's fine. I mean, we'll work that out for you and we'll give you an exact date. Can I just make sure, has your midwife arranged your 8-week ultrasound already?
Yeah, we had that, although I don't know if it was 8 weeks. Let me just think. It was Mum's birthday on the 1st, so actually, yeah, it would have been about 8 weeks.
Okay, so we'll get the results of that and we'll also give you an accurate date.
For the due date, yeah?
Yes, the due date as well.
Okay, so how often is it actually on the due date?
Hardly ever.
Hardly ever, okay.
I mean, it's not like, they can happen, but it's very rare.
Okay, so before?
But your due date's actually a month, so anywhere from 37 to 42 weeks. So the due date is really definitely an estimate.
Okay, so really it's kind of 2 weeks either side of the due date.
2 weeks either side of the due date.
Okay.
And any problems at all falling pregnant? You had no fertility problems?
Well, I'd been on the pill for about 12 years or something, and we thought it would take a long time, perhaps. But when I went off it,
Sure.
Yeah, the first month.
Okay, yeah, that's fine. So I can see from your file that you have a family history of diabetes.
Yes.
But you don't have a history of any hypertension or cystic fibrosis.
Nope.
Okay. The allergies part in your file was blank. Are there any allergies we should be aware of?
Yeah, actually, I'm allergic to nuts.
Okay, just peanuts or all nuts, do you know?
I'm not sure actually, but to be honest, I just tend to avoid all nuts.
Okay, I'll add that to your file.
Thank you. Yeah, so one thing that I had wanted to mention is that I recently found out my blood type is Rhesus negative.
Okay.
Yes, so I just wanted to talk about that a little bit because I have heard that it can be dangerous if my blood mixes with the baby's blood, if the baby's blood is different to mine.
Have you had any bleeds?
No, I don't think so. Is that something that I should be looking out for?
Yeah, certainly. Look out for bleeds, and they'll also pick it up in your scans. If you notice any bleeds and if the blood is bright red, come to the hospital immediately for treatment. We'll give you an injection called anti-D, and it will essentially prevent any harmful effects to the baby.
Okay, so an injection of anti-D, that's all I need to do then?
At this stage, yes.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 1 to 6, choose the answer A, B, or C, which best fits according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Test 3. Now look at question 1. You hear a nurse's handover. Now read the question.
Hi, my name's Nicolette Walters. I've just been beat. What's happened?
Hello, my name's Catherine Perriman, and I was passing by the ward. I saw a patient that looked unwell. I went to assess her. She wasn't breathing, and I administered CPR.
Do you know much about her background?
No, I don't. I don't know much about the patient's medical history. She's not under my care. I work in this hospital, but not on this ward. So far, I've applied a trapezius squeeze and I've received no response. I checked for obstructions to her airway and the rise of her chest for 10 seconds. That's when I called you and commenced CPR.
Okay.
I've done 3 cycles of CPR, 30 compressions of 2 breaths, at a rate of 100 to 120 beats per minute and a depth of 5 to 6 centimetres. I'd like to recommend that this patient is transferred to a critical care unit for further assessment and that you continue CPR until signs of life.
Thank you. I can take it from here.
Thank you. If you need me, I'll be at the nurse's station during my documentation. My phone number is 07989 033 444 if you need me. Are you happy for me to leave now?
Yes. Thank you, Catherine.
Now look at question 2. You hear a team of midwives discussing a difficult delivery. Now read the question.
Thanks for coming, Ray.
What's the matter?
I'm not too sure. The patient was fully dilated at 9 p.m, but there's no sign of the baby. What time is it now?
10:30. Are the contractions regular?
Yes, they've been constant too.
Oh no, maybe this is an obstructed labour.
What's that?
It's when the baby is physically blocked from coming out and it could be caused by anything. Was there any indication that the patient has a small pelvis or a narrow birth canal?
No, nothing in her notes.
That's strange. Well, it could just be the baby's positioning. This may have to go to the forceps.
But the uterus is contracting normally.
I know, but the baby should have exited by now.
I'm really worried. It's been a long time. Over an hour and a half, Ray.
Yes, if we don't act quickly, the baby might be losing oxygen. Cheryl, he could die.
What should we do?
We'll have to call the doctor.
Now look at question 3. You hear a paediatrician discussing a jaundice action plan. Now read the question.
I know you're anxious, particularly as this is your first child, but let me assure you that jaundice is completely normal in newborns, especially those that are premature. It will usually go away within 10 to 14 days of its own accord. I will, however, arrange to take a blood sample to check bilirubin levels. This will be to look at the liver function. Something that you can continue to do is to feed the baby often and expose baby to natural sunlight. The latter is a great way to alleviate jaundice and its symptoms. If, after a few weeks, the jaundice is still present, we'd like to admit baby and do phototherapy, which, as the name suggests, is the use of light to reduce the bilirubin levels. Phototherapy or light therapy would involve placing baby under a special light that emits light in the blue-green spectrum, which encourages the bilirubin to be excreted in the urine and stool, which is why we suggest also feeding baby frequently to encourage this naturally. If in a rare case the jaundice doesn't respond to these treatments, we will look at intravenous immunoglobulin or even an exchange transfusion. But let's cross those bridges if we get to them.
Now look at question 4. You hear a pair of district nurses discussing a new project. Now read the question.
Phew, you've not yet left.
No, I'm still here. What's wrong?
Nothing. I'm a little stuck on writing up this project.
The one on mental health difficulties in men over 50. Which part are you stuck on?
All of it.
It's not that bad, is it?
No, it's not. I've got the purpose part done. We set out to improve the mental health of men over 50 living in Staines.
Right.
Then I go on to talk about how we created groups and matched the participants based on their interest. We met once a month promoting social inclusion and development of skills. A GP was invited monthly to talk to the participants about issues that affect them, such as isolation, depression, and fighting suicidal thoughts. The theory is that doing this should have had a positive effect on the participants' well-being.
And did it? I mean, what was the result?
Yes, it worked surprisingly well. So far, the project lasted 6 months, and now the only problem is that the write-up's probably going to take 6 months as well.
Now look at question 5. You hear a dentist discussing the scaling and polishing procedure. Now read the question.
Patients often come to the practice for a procedure known as scaling and polishing, and it's a highly recommended procedure. It takes place in 2 stages, the first being the scrape. This is to remove deposits of plaque and tartar from around the teeth using an ultrasound scraper to remove bulk buildup of tartar. Then, a specialised handheld instrument is chosen to scrape away any remains that are harder to remove. I usually clean around the gum line and along the back and front of each tooth, taking extra care to rid the mouth of plaque and tartar in particular. After this is successfully completed, the polishing stage begins. The first job is to polish each tooth so that their surfaces are really smooth. The idea here is to make each tooth bright and shiny, as well as removing minor imperfections and leaving rough texture on the surface of the tooth to guard against plaque buildup. Patients are advised to incorporate routine scaling and polishing as part of good oral health practices. Scaling and polishing every 6 months should be seen as enhancing good daily practices like brushing, flossing, rinsing with antiseptic mouthwash twice daily.
Now look at question 6. You are a nurse and patient discussing an upcoming trip. Now read the question.
Hello, Danny. How are you?
I'm very well, thank you.
I understand that you'd like advice on travel injections for your trip next week, is that right?
Yes.
Where are you going to?
Malaysia?
How nice. For how long?
2 weeks.
Great. Do we have your immunisation records here?
I think so, because I had some a few years ago.
Do you have your yellow card? Because I couldn't find any records.
No, I misplaced it, but I think I'm due to have them all regardless.
Okay, for Malaysia you need yellow fever, typhoid, hepatitis A. You also need malaria tablets, which you can get from any chemist.
Okay.
Before giving you the injection, I'd need to fill out these health questionnaire forms.
Okay.
Are you pregnant?
Yes.
How many weeks?
26 weeks. Why?
Because Malaysia has Zika virus and the baby can get the infection. The government advice is that women should avoid going to Malaysia if they are pregnant because of Zika virus, which can be very serious. I would therefore advise you not to go to Malaysia until you've had the baby because your baby can be infected.
Oh, I didn't know that. Unfortunately, I have to travel for personal reasons. Are there any precautions I can take to prevent my baby getting infected?
Besides, not travelling there, which is my advice, you can avoid crowded, dirty environments, observe strict hygiene conditions like washing your hands as often as possible. Use hand sanitizers regularly, which you can also buy from any chemist.
Is there an immunisation against Zika virus that I can have to protect my baby?
There's no immunisation for it, unfortunately.
What problems can it cause in the baby if infected?
The best case scenario is that it may not cause any problems at all. However, it prevents the head bone called the skull from growing. As a result, the baby's head is very small. The baby will not look normal and the brain will not grow. The baby will be mentally, you know.
Oh my God. I don't know what to do now. The flight and the hotel have been booked and we won't get a refund if we cancel any of those.
Do you want to go home and think about it? I'd advise that you come and discuss this further with the doctor.
Okay. Can I take the immunisations anyway and then you make me an appointment with the doctor to discuss it further?
Yes, the possible side effects associated with injections are a bit of pain, and swelling at the injection site within 24 to 48 hours of the injection, bleeding, bruising, or infection at the infection site may occur, but this is very rare. Some people may have ever...
Are they safe for my baby?
Yes.
Okay, and thank you. Please don't forget the appointment with the doctor.
It's next Tuesday to see Dr. Morgan at 2:30. Enjoy your trip if you travel.
Thank you so much for everything.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you will hear 2 extracts. In each extract, you will hear health professionals talking about aspects of their work. For questions 7 to 22, choose the answer A, B, or C, which fits best according to what you hear. Now look at Extract 1. Extract 1, questions 7 to 14. You hear a Dr. Paul Arnold giving a lecture on respiratory systems. You now have 90 seconds to read questions 7 to 14.
My name is Dr. Paul Arnold, and I'm a specialist in respiratory systems. The topic I will be presenting today is lung disease and the increasingly detrimental effect it is having on the UK healthcare system. Lung disease in the UK is highly prevalent, with a reported 12.7 million residents suffering from some form of lung disease or asthma in 2017. These figures appear to be on the rise, with only approximately 8 million residents suffering from some form of lung or respiratory disease in 2012. This is worrying news, as lung disease is one of the biggest killers in the UK. In a 5-year period from 2008 to 2012, lung diseases were responsible for 20% of all deaths, and the number of deaths caused by lung disease has remained constant thereafter. Lung cancer was the most prominent cause of death, responsible for 6.1% of all lung disease-related deaths, with pneumonia second, accounting for 5.6% of deaths. On top of this, lung disease can cause significant shortages of breath whilst completing even simple tasks and lead to potentially lifestyle-altering side effects. However, the causes of lung diseases are well recognized. The chronic obstructive pulmonary disease, COPD, which has several key causes, smoking, fumes and dust at work, air pollution, and genetics are all NHS-given causes for the disease, which affects 1.2 million people throughout the UK. These causes help us to better understand why lung diseases are becoming more prevalent. The UK had 9.4 million cigarette smokers as of 2013, which, according to The Guardian, 2017 was the second lowest rate in the EU. Smoking can increase your chances of getting a more severe lung disease. For example, bronchitis becomes chronic for 1 in 20 patients who do not smoke, whereas that number is far higher for those that do. In contrast to smoking, the UK is only 10th best in Europe in terms of air pollution quality, and this could ultimately be the cause for a rise in lung disease cases. As COPD currently has no cure, it is therefore pivotal to improve air quality and smoking. A further worrying statistic to bring to the fore is that in the UK, approximately 2/3 of people with COPD are unaware or have not been clinically diagnosed. This is disturbing as sufferers are therefore unaware of the treatment that they must undergo. Treatment for most lung diseases can help to slow the progression of the condition and control the symptoms. For COPD, short-term and long-term bronchodilator inhalers are used to make breathing easier by relaxing and widening the airways. Most inhaler dosages last at least 12 hours. The most effective treatment that can be administered to a smoker with lung disease is to simply stop smoking. Lung disease is most prevalent in certain demographics and in certain areas. In 2012, 21.2% of all male deaths in the UK were due to lung disease, compared with just 19% of female deaths. The problems are further exacerbated with age, with lung disease, and in particular COPD, becoming far more common in people ages 65 and over. In the UK in 2012, the cause of death in ages 65 and over was 21% due to lung disease, which was equal to all non-lung cancer-related deaths. Furthermore, likelihood of suffering from a lung disease increases largely if you live in northwest and northeast England and central Scotland. Finally, the economic impact of lung diseases is high. This should come as no surprise due to their high prevalence. In 2011, 8% of all hospital admissions and 10% of all inpatient bed days were due to patients suffering from lung disease. Once again, pneumonia and COPD were the biggest culprits. Lung disease is clearly a great problem facing the UK healthcare system, with changes to smoking and air pollution necessary to combat the issue.
Now look at Extract 2. Extract 2. Questions 15 to 22. You hear a doctor, Carl Harpenden, giving a presentation on diabetes. You now have 90 seconds to read questions 15 to 22.
Hello, my name is Dr. Carl Harpenden, and I'm a general practitioner specializing in diabetes and blood rate levels. My topic today is an increasingly prominent concern in healthcare: type 2 diabetes and the most effective means to combat its onset. Type 2 diabetes is an extremely common condition that causes the level of sugar, glucose, in the blood to become too high. It is a lifelong condition that often causes a change in lifestyle so as to negate its impacts. About 90% of diabetes sufferers are suffering from type 2 diabetes. In the UK as a whole, there are approximately 4.5 million diabetes sufferers, which represent approximately 6% of the entire UK population, although there is still a large number of people who are currently undiagnosed. Type 2 diabetes is caused when a person's pancreas fails to provide enough insulin to the body, which leads to high blood glucose levels. High blood glucose or blood sugar levels can lead to hyperglycemia, which can lead to several side effects such as long-term damage to the eyes, nerves, kidneys, and blood vessels. The symptoms of type 2 diabetes are relatively easy to identify. As your body can't get enough glucose in your cells, you will feel unusually tired. Furthermore, you will need to wee lots, get extremely thirsty, your cuts and bruises will heal slowly, blurred vision, and you will find yourself more susceptible to infections such as thrush. You are at risk of suffering type 2 diabetes if you are over 40, or if you are South Asian, that number falls to 25. African Caribbeans and Black Africans are also more susceptible to the condition. Ultimately, you are most at risk of type 2 diabetes if you are overweight or obese. That is not good news for the UK, where 28% of its residents are obese and 63% are overweight. Obesity and its links to type 2 diabetes are of such concern that it is believed obesity and BMI is thought to account for approximately 85% of the risks which lead to the development of type 2 diabetes, whilst your chances of developing the condition increase by 80 if you are obese. Clearly, there is a correlation between the two. Despite these figures, obesity is a relatively easy state to overcome. A balanced diet coupled with an active lifestyle can lead to a more healthy physique, and thus reduce the risk of developing type 2 diabetes. The risks and lifestyle associated with a common prevalence in type 2 diabetes is more important when we consider the number of sufferers thought to have not been diagnosed. In the UK, it is believed that up to 550,000 people have type 2 diabetes that as of yet have not been officially diagnosed. This is an alarming statistic when you consider a 2011 NHS report which claimed that there were 24,000 excess deaths per year from diabetes sufferers. Evidently, there is a high mortality risk attached to a type 2 diabetes sufferer who is not diagnosed. Fortunately, for those who are diagnosed, the treatment and help available is very good. Most people with the condition will be offered the drug metformin, which can be used to help reduce blood sugar levels. Insulin is rarely offered in the early years of treatment. Diabetes medication can lead to side effects such as bloating, diarrhea, weight gain or weight loss, sickness, and swollen ankles. Ultimately, the treatment for diabetes is helping millions of type 2 sufferers from across the UK deal with a serious condition in a way that allows them to continue to live normal lives.
That is the end of the listening test.